Are ready to get started. Thank you so much. Welcome to our first family education workshop in partnership with Archway Academy and Fusion Academy. We want to extend a very warm welcome to everyone. We are super thankful that you're here. This partnership series was created in response to a shared understanding and awareness of the need for relevant resources for families as we all navigate the changes that we're experiencing as the result of the impact COVID has created in our nation, in our communities, and our homes. We fully understand we're navigating uncharted territory and collectively agree that sharing our resources not only with our professional communities, but our communities at large, it's our privilege and it's our responsibility as we make our way forward in our new normal. My name is Amanda Franklin. I'm one of the National Referral Relations Representatives, that's a mouthful, here to say at Skyland Trail. And before we get started, I'm going to tell you a little bit about us. As many of you may know, Skyland Trail specializes in treating adolescents and adults with primary psychiatric diagnoses. Our adolescent program focuses on teens aged 14 to 17 with depression, anxiety, bipolar disorders, and OCD. And our residential and day treatment program for adults focuses on mood, thought, and anxiety disorders, as well as our specialized programs which help young adults experiencing their first episode of psychosis. Next, I'm going to introduce you to Jamie Edwards, who is the Director of Community Relations for Archway Academy in Houston. And Jamie, if you will turn your camera and your mic on. Thank you.
Hi, thank you so much, Amanda. Archway Academy is a recovery high school in Houston, Texas. We meet the individual educational needs of teens recovering from substance use disorder while meeting all state requirements for awarding a secondary school diploma. We are currently the largest recovery school in the country and are presently mentoring 16 new recovery schools throughout the nation. We opened our doors at Archway in 2003 to offer students and worried families in the throes of teenage substance use a viable option and support system for restoring their child's physical, mental, emotional, and academic health. Instead of returning students to the same environments in which they are most at risk for relapse, Archway provides a structured place for teens to continue both their recovery and their education without compromising either. Keeping students sober and in class is our priority. While our organization plays a dual role, our staff do not. We are not therapists who tutor or teachers who counsel, but specialists in our respective fields in close communication with each other and our students throughout the school day. Our teachers and administrators are experienced educators. Our recovery coaches and staff bring diverse backgrounds and degrees in clinical, therapeutic, and peer support care. We believe everyone's pathway through recovery is unique, so we structure our programming accordingly. Our class sizes are small and our low student-teacher ratio allow us to catch our students wherever they are and personalize a program that's best for them. Many of our students deal with co-occurring issues, so we work collaboratively with adolescent mental health professionals to offer a full continuum of care for our teens. It is because of this that we are pleased to be in partnership with fellow adolescent providers, Skyland Trails and Fusion Academy for this partnering series. Thank you for having us.
Thank you, Jamie, very much, very, very much. If you want to visit their website, it's archwayacademy.org. And next, I want to introduce to you Guion Weaver, who is representing our partnership with Fusion Academy, and she is their Director of Development in Texas. Guion?
Hi, good evening, everyone. My name is Guion, and I am the Director of Outreach for Fusion Academy DFW region here in Texas. I get to help support 3 of our 58 campuses across the country. Fusion is a revolutionary private school for grades 6 through 12, but we're really unique in the sense that all of our courses are taught one-on-one, meaning one student and one teacher per classroom. So this allows our teachers to not only personalize the curriculum and teaching for each student's individual strengths, interests, and learning styles. Our supportive campus environment is also unique in the sense that it includes a state-of-the-art recording studio, a mixed media art studio, and a space on campus we call Homework Cafe, where students complete all their homework before going home. So it really is that intentional balance between class time and socialization with their peers. Students come to us for a variety of reasons, but the common thing they share is that traditional schools haven't worked. So whether that's them needing flexible scheduling, they are struggling with school anxiety, or they have a learning difference, we're able to support them. We offer part-time tutoring and full-time program year-round. So if you have any questions, please don't hesitate to reach out. And thank you so much for joining us tonight.
Thank you, Guion. And their website is fusionacademy.com if you want to learn more information about the services provided for either school. Thank you, Guion. Okay, so before we begin our presentation, I want to take a moment and present our speakers. First, Dr. Shanee Toledano is a licensed psychologist and nationally certified school psychologist who specializes in the treatment of OCD and anxiety disorders, along with parenting interventions. Dr. Toledano leads our OCD and anxiety program. And I also want to introduce Ashley Lanier-Pszczola, and she's an associate licensed and systemically trained marriage and family therapist. And Ashley's experience includes implementing school and community-based therapy programs. And Ashley is currently, she leads our family therapy program in our adolescent program. So thank you both so much for taking your time to share your knowledge and experience with us today. Thank you.
Thank you, Amanda, for that nice introduction. We're so glad to have everybody here and to be able to kick off the family education series. So Shanee and I work closely together and have collaborated on this presentation. So we're just going to jump right in and talk about tolerating uncertainty, tips for parenting in uncertain times, which we're living in some very uncertain times right now for lots and lots of reasons. And so we hope to give you some really concrete ways of responding to uncertainty, helping your children, kids and teens and young adults tolerate uncertainty, and hopefully also learn some strategies of tolerating uncertainty in yourself so that you can model those as well. So the first thing we're going to talk about is just to get a general kind of understanding of anxiety. So we're going to talk about anxiety cause and effect. So what is anxiety? Anxiety is a false alarm that goes off to signal danger. This happens when your brain is kind of sending impulses to your body to fight, flee, or freeze. I always stumble over that. And so these are kind of the physical effects of anxiety that are popping up in your body. Anxiety is beneficial in some amounts, right? Feeling stressed out about a test or certain things, something we have to do at work, a presentation, can help us take that thing really seriously and prepare for it. And often a question that we're faced with and we get asked is, when does anxiety become problematic? So anxiety becomes problematic, and by problematic, I mean, needing treatment or an intervention, when it's preventing you or your teen in this case from doing fun and important things that you want to do. So when you want to do something and anxiety is really getting in the way of that, that's a problem. So going to school dances or parties, just going to school in general, sometimes for kids and teens, anxiety gets in the way of. Making friends or dating, getting your homework done, or getting a job or your driver's license. And so I want to point out some worries and anxious thoughts. So what anxiety looks like and what you might commonly hear from a person, a teen, or a child that's kind of expressing anxiety to you. So you may hear a lot of what if statements from them. So what if I fail the exam? What if I say something stupid? What if they laugh at me? What if the needle really hurts? What if I touch something gross and get sick? I think that is one that's coming up a lot right now with COVID. What if I crash the car? Comes up for a lot of teens around getting their driver's license. Or for parents, a lot of the times we hear things like, what if, you know, after going through this treatment, it's interrupted their school year? What if my teen doesn't graduate? What is their future going to look like after this treatment? And so sometimes you may hear that very specific what if statement, and oftentimes it doesn't sound like that. It may sound like something else, but asking yourself, is there kind of a what if behind that when someone is expressing a fear or a worry? And that's going to give you a pretty good indicator of is this anxiety talking right now? So next I'm going to talk about the effects of anxiety. So the effect, what happens when we feel anxious, is that our thoughts focus on all the bad things that might happen. So we start to imagine the worst and really get worried. And we've all been there in an anxiety spiral where we've started to kind of worry about, what if this happens, then this would happen, then that would happen. And you just kind of allow yourself to really go there with it. Before you know it, you're 10 years down the road worrying about, if they don't go to college, then they're not going to do this and they're not going to do that. And again, this can be helpful. Sometimes that anxiety and that stress is there to help us prepare to deal with a scary situation. It's not a bad thing to be able to see several steps ahead sometimes and think about what's going to happen. When it becomes a problem is when what happens sometimes is when you get that far down that spiral, as I'm sure a lot of us have experienced, we feel paralyzed and it makes us just want to run away and hide. And often this is a common thing that we see with kids, and we'll see things like school refusal and things like that because they just don't have the words to verbalize that feeling of anxiety. And so it is making them want to just remove themselves from the situation altogether. And what that might look like for a kid or a teen who has a hard time verbalizing that is, I have a stomach ache and I don't want to go to school, or I'm just not feeling well today, or I just can't handle going to school today, right? And so that may be one of those times where they're not saying, what if I fail the test? What if I get sick at school? But there are some pretty solid worried thoughts underneath that. So I'm going to turn it over to Shanee, who's going to talk about tolerating uncertainty.
Yeah, so now we're going to talk about a special case of worry or anxiety called difficulty tolerating uncertainty. When we think about a worry, we usually think it's about expecting the very worst outcome to happen. So if I'm worried about getting sick, the worry sometimes takes the form of, oh no, I really will get this illness. And that leads me to engage in all kinds of behaviors to avoid the illness, like washing my hands over and over again or making sure my mask is really tight. There's a second component of worry that we're not usually as aware of. So it's the simple discomfort that we feel because as humans, we really dislike feeling uncertain about what will happen next. We have to face the unknown or the fact that there is no answer available. So this is the part of a worry that says, I don't know if I will get sick, and it's really uncomfortable to me to not know. Therefore, I feel the need to engage in any behavior that will help me feel more certain of what will happen. When we're trying to reduce our uncertainty, there are several approaches we typically take. The first is to try to make ourselves feel more certain that a positive outcome will happen. So you'll go out of your way to make sure that you're doing everything you can to be safe. When we're facing the fear of COVID-19, this could look like practicing all our routines for going to the grocery store or to school. We would make sure everyone remembers their personal protective equipment. We would maybe do a few safety checks before we leave the house. Using another example, if you're a student who's worried about passing a test, you'll spend hours and hours making sure you know the right answers. We can also try to reassure ourselves of a positive outcome by taking personal control of a situation instead of sharing responsibility with anyone else. If you've ever noticed you're the person who likes to take the lead on a group project, it might be because it's too difficult to tolerate the fact that you don't know how much time and effort everyone else in your group is willing to spend. Finally, we can take a direct approach of telling ourselves in our minds everything is going to be fine, or asking other people we trust to give us verbal reassurance that a positive outcome will happen. Kids and teens who experience anxiety will often turn to their parents when they want to feel more calm. And that's because they're used to trusting the information that their parents give them. It doesn't matter how much they understand on a very logical level that no one has the answers in uncertain times, even parents. So here's another approach we might take when we're trying to reduce our uncertainty, and this is the one that can feel really counterintuitive. Instead of dealing with the discomfort of not knowing, sometimes it feels easier to cope with a certain truth that the negative outcome will happen. So we actually gear our thoughts and actions toward the worst case scenario. In terms of thoughts, catastrophizing is a type of thought distortion or thinking trap where we try to convince ourselves that the worst possible outcome will happen. Not only will I contract an illness, but it will land me in the hospital with really serious symptoms. Overestimating danger is a related type of thought distortion or thinking trap where we estimate that the chance something bad will happen is much greater than it really is. Instead of coping with the uncertainty that comes with a 30% chance of getting an illness, I might prefer to tell myself it's a 99% chance I'll get sick. And that way I can feel mentally prepared for the worst, so I don't have to worry about feeling surprised or disappointed when it happens. It's like the expression ripping off the Band-Aid. You're going to make yourself feel some pain now in order to eliminate the anticipatory anxiety that comes with not knowing if it's going to be bad later. The last example is one that continually baffles parents and teachers. So if you've ever been in a situation where your teen is expressing lots of fear and anxiety before taking a test and is worried about failing that test, and then they stay up all night playing video games the night before the test. It doesn't make any sense that they would do this until we realize that engaging in a self-defeating action takes away all the uncertainty, and again, takes away that anticipatory anxiety. I think I did something wrong here. Sorry, guys. There we go. One more thing we might do, and this could be either helpful or harmful depending on the context, is avoid the feeling of uncertainty altogether by stopping anything that makes us think about it. So this is what we're doing when we turn off the news for good and instead get really immersed in a Netflix show. Or when we procrastinate, which buys us plenty of time to not think about a problem that we'll need to solve later.
I'm still muted. So I'm going to talk about uncertainty as an allergy. And a question that I always like to ask is, are you allergic to uncertainty? And what I mean by that, an example that I like to give kids and parents is that I'm allergic to pollen. So when it's pollen season here in Georgia and literally everything turns yellow, that because I'm very allergic to pollen, one of my strategies is to try to avoid pollen. But it very quickly gets to some point where I cannot avoid the pollen because it is literally everywhere. And so uncertainty is just like that. It is a part of daily life where we are going to be unable to avoid it. So if avoidance is your only strategy, in my example, if I didn't take allergy medicine and just focused on avoiding my pollen allergy and just avoiding pollen, that would lead to a lot of time-consuming behaviors. Like I would have to stay in my house to avoid being in contact with pollen at all. So because uncertainty is a part of daily life, if you're trying to avoid uncertainty at all costs, this is going to lead to some very time-consuming and tiring behaviors. And these actually cause stress and anxiety and fuel worry. And of course, anxious people are more likely to be intolerant of uncertainty. Like Shanee was just mentioning, that uncertainty is a type of anxiety. I think I have it here. All anxiety is due to a little bit of uncertainty, and anxiety feeds on doubts, right? It feeds on those uncertain doubts. So seeing something that says, this hand sanitizer is 99% effective. Anxiety is going to focus on that 1% that isn't effective. It's not going to pay any attention to the 99. It's going to say, what if I get the 1%, the 1% of the population or whatever that it doesn't work on. And so I mentioned this to Shanee when we were putting this together, of you get prescription medication that you pick up from the pharmacy, and they give you this giant packet of side effects that goes with it, right? That has all the information about all the side effects that could possibly happen. And at the top, it'll say something like only 10% of people experience these very severe side effects. Well, my anxiety is not going to focus on the fact that 90% of people take that medication and don't have those side effects. My anxiety is going to tell me, you need to read that so you can be exactly certain of what's going to happen to you, because you may fall in, you're probably going to fall into that 10% of people. So I'll focus on the negative and catastrophize that for myself because of that level of uncertainty, if I'm a person who's really intolerant of that uncertainty. And again, uncertainty is an unavoidable part of daily life. So it's really important to be able to have strategies to manage it within ourselves. And we're going to give some information as well about how we can respond to kids in a way that is going to help them tolerate uncertainty in their world and in their life and set them up for success. So I'm going to talk a little bit about reassurance seeking. And reassurance seeking is a pretty common behavior we see from kids who have a high level of anxiety. Kids and teens look to their parents as their people who help them navigate the world, right? Like and I am 27 and I still do that. If I feel weird about something, or like, I don't know if I cooked my chicken long enough or not, I call my mom, right? And my mom is very nice and gives me a lot of reassurance that I'm going to be fine if I eat chicken that's a little bit undercooked or something like that. But anyways, kids look for their parents to reassure them that everything is okay. And of course, that's a natural part of parenting and kind of a natural feeling for parents. What's problematic is when we reassure feelings that come from a place of anxiety. So if we're reassuring a child or a teen's anxiety, this can be problematic. So what does reassurance seeking look like, just to give you a clearer idea? So we may hear a child or a teen asking many friends or family members and kind of surveying everyone they know their opinion on a big decision they have to make. So do you think I'll be happier at UGA or Georgia Tech? Or what will happen if I pick the wrong major, right? And they may not only ask you and like a couple trusted adults that, they may be asking every adult they come into contact with that question. That's a pretty clear indicator of like excessive reassurance seeking. Or we may hear them like asking the same question over and over, like to the same person, to the same adult. So, and this is especially a question with an unknowable answer. And by unknowable, I just mean that it's something that, you know, has lots of different possibilities. It's kind of uncertain, right? So do you really like me, or are you just being nice out of obligation? And if I'm asking you that kind of over and over again, that points to a what if worry. What if you don't like me? What if you're just being nice to me? And I need certainty on that. And that's something that we can't have certainty on. It's unknowable. Or am I safe? Is something that, you know, kids may be asking, especially right now with all the things that we have going on with COVID, you know, racial injustice, all the things that are happening right now. We may hear kids asking things about, am I safe? And that is unfortunately unknowable, right? We hope you're safe, and I'm going to do everything to keep you safe, but I don't know, that I don't have a very concrete answer for that question. So reassuring that to a kid who experiences a lot of anxiety, to a kid who doesn't, you know, reassurance may be all that they need and they'll move on. But to a kid who experiences a lot of anxiety, a reassurance is going to kind of feed into that. So what is the parent response? How can we, avoid reassurance seeking? So again, anxiety wants a solid answer, but an unknowable thing doesn't have an answer. So we hear things from kids like, do you really love me, or do you just have to say that because you're my mom? Well, I can say, of course I really love you, sweetie, but that's reassuring for a second, and then it's like, you could have just said that because you're my mom, and that's unknowable, right? You can't really know what I really mean by that. So responding from a place of reassurance and comfort can actually feed anxiety and reinforce the need for reassurance. So next time I have that feeling that, does somebody really love me, or are they just being nice out of obligation, I'm going to have to ask them, which will reduce my anxiety in the moment, but it's going to continue my need that I need that reassurance in order to feel less anxious. And every time I'll probably need a little bit more reassurance in order to feel less anxious. So the things that we can do that are helpful when kids are having a lot of reassurance seeking is helping them point out anxious and worried thoughts. So what we were talking about earlier, looking at those what ifs, being able to identify what those what ifs are. And what this does is help us to get into an observer stance and helps kids model that. And what we mean by observer stance is that I can observe that I'm having an anxious thought without letting that thought kind of overtake me. And the importance of that is that I have the ability to kind of respond to that anxious thought instead of let that anxious thought or worry be in control of me. And you can I think a lot of times parents think that this doesn't feel compassionate, that the reassurance is kind of the loving response from the parent. Absolutely it is. So it doesn't feel loving or compassionate to not say things like, of course I love you, sweetie. Of course I'm not just saying that because I'm your mom. I would love you anyways. And we want to point out that you can still have a compassionate response without validating the worry. So you can validate feelings that the kids are experiencing or the teens without validating the worry. So responding and saying things like, I wonder if that's a factor in anxious thought. That sounds like a worried thought, right? Or I hear that you feel really uncomfortable with not knowing the answer to that. That points really clearly, I see you, I feel that you're very uncomfortable. I'm your parent, so that probably makes me very uncomfortable to see you in that distress. And I'm still not feeding into your anxiety by giving you that reassurance and letting you know that what we want kids and teens to understand is that all anxiety eventually reduces on its own, that you don't need reassurance in order for anxiety to go down, and they can handle that feeling, right? We hope at some point they launch into adults and we're not going to always need to reassure them, and we're not always going to be able to reassure them. So recognizing that anxiety eventually reduces on its own and that they can handle that feeling as it comes up. All right, so I am going to talk now, and Shanee's going to finish up the second part of this, about some responses to anxiety. So we've talked a little bit about how to respond to reassurance seeking, and then these are just some concrete tools of kind of how to deal with tolerating uncertainty or tolerating those intense feelings of anxiety. And these are these are tools that we use here in our program, as well as, that we encourage parents to use as well. All right, so first thing that I'm going to talk about is radical acceptance. Radical acceptance, if anyone's familiar with DBT or dialectical behavioral therapy, it's okay if you're not, but this is a DBT skill that we teach here in our group. So radical acceptance is, or being able to tolerate uncertainty is helped by being able to accept reality. So for me, these things go together, because I think a lot of not being able to tolerate uncertainty is trying to have like everything planned out and a lot of ideas of what I could do in a situation, instead of just kind of accepting things for how they are right now in this present moment. So radical acceptance is the skill of accepting things you can't change, which is a very difficult skill for most people, not even just anxious people. For most people in general, that's pretty difficult to accept what you can't change. But acceptance helps you to cope effectively with your emotions and move on rather than suffering with bitterness. Sometimes a lot of our anxiety is tied up in, suffering and sitting there saying like, I would feel better if COVID wasn't going on, or I wouldn't be so anxious if this wasn't happening. So I have to plan, I have to wear my mask, I have to do all this, which really is not accepting things as they are in the present moment. And the really important thing here, and I'll continue to talk more about this, but acceptance is a choice. So you always have the choice to accept reality. And I'm going to talk more about how to do that. So just to give a quick example, what can and can't be changed about the current situation with COVID? So, and we don't have any control, or we can't change the uncertainty of it all. We can't change places being closed that we might want to go to. We can't change social distancing, being unable to see friends and family and really missing them, wearing uncomfortable masks and gloves, having the thought of I might or might not get sick. That's been a very hard thing for me to sit with, that every time I leave my house, I may or may not get exposed, and I can't change that. People I know might or might not get sick, and of course that lots of us are stuck at home. And so thinking about, with this situation, what are the things that we can't change? So what have you accepted about the current situation? And I think as we're kind of moving into this new phase, I think some of us are probably at a more accepting place than maybe we were a couple months ago when this was happening. But what have you accepted, and what are you fighting against? What are you digging your heels in and saying, no, will absolutely not accept the fact that maybe for the rest of this year I'm going to have to wear a mask when I leave my house? And how much control do you have over these things? So the things that you're really digging your heels in and refusing to accept about the reality of the situation, do you have control over those things or not? And how much of your current suffering is tied up in your willfulness? And willfulness meaning being unwilling to accept reality as it is, because acceptance is a choice. And so there are a couple of things, like I've just mentioned, that interfere with acceptance of reality. The first one is belief. So this is believing that if you accept a painful situation, you are being weak, you're becoming weak, you're just giving up, that you approve of reality, or that you're accepting a life of pain. So sometimes it's worth asking yourself, do I have one of these beliefs? If I accept that that COVID is happening and kind of the state of my life and my community right now, does this mean that I'm approving of COVID, or that I'm accepting that I'm always going to be in pain or be suffering? And the important thing to remember is that acceptance does not equal approval. So just because we've accepted something does not mean we approve of it. The other thing that gets in the way of acceptance is emotions. So you may feel intense anger at the person or group that caused the painful event. You may feel unbearable sadness at a loss you've experienced, guilt about your own behavior, something you should or shouldn't have done, shame about something about yourself, rage about the injustice of the world, I think is one that is coming up for a lot of people right now, because it is such an overwhelming feeling that it's hard to know what to do with. And I think often it feels like if I accept that this is the world I live in, that means that I'm just rolling over and going along with it. but remembering that those two things that seem opposite can exist at the same time, that acceptance does not equal approval, and you can accept reality without approving of the current situation or circumstances. And the reason that this is important, the reason that accepting reality is really important, is that seeing reality for what it is can convert suffering into pain that you can cope with. So suffering is something that you can't cope with, you can't change. It's too big and too hard of a thing. It's not a workable problem. Pain is something we can deal with, we can figure out, and we can manage. And you can, if you're able to accept reality as it is, this helps you gain clarity on what to do and be able to progress your life instead of staying stuck. And I'm going to turn it over to Shanee to talk about exposure approach to tolerating uncertainty.
Yeah, so here's another approach in addition to radical acceptance that can really help. Let me talk about exposure a little bit and what this is. Exposure therapy is the type of treatment that has the strongest evidence for treating anxiety disorders like obsessive compulsive disorder, OCD, social anxiety, specific phobias, and panic disorder. Using the exposure approach is also really effective when you need to tolerate uncertainty, even if you don't meet criteria for any of the anxiety disorders that I just mentioned. Exposure teaches individuals to approach whatever it is they're avoiding because of their anxiety. For instance, when someone has a fear of public speaking, exposure trains them to gradually build their tolerance to the anxiety of speaking in public, instead of building a career or a lifestyle around the avoidance of making speeches. When you approach the situation that makes you anxious or uncomfortable, you give yourself opportunities to learn the thing you're worried about might not actually happen. If the thing you're worried about does happen, guess what? You're strong enough to handle whatever feelings come up for you, like sadness, disappointment, or even a more intense feeling of anxiety. And you're also learning that there are other ways to live your life besides avoiding anxiety. Your avoidance strategies probably aren't making your life any better. And again, you can tolerate more distress than you probably think. So let's use an example with social anxiety to demonstrate each of these outcomes. Imagine you're thinking to yourself as a teen, I can't ask my teacher a question because he doesn't like me, and I'll feel embarrassed if he shows he doesn't like me by criticizing my work or telling me it's a dumb question. Through exposure therapy, I would gradually work up to asking my teacher a question. Maybe, first start by asking in writing and then move up to something like a face-to-face interaction that might be a little bit tougher. And now imagine my teacher responds well. I can tell myself, the thing I was so worried about wasn't really that likely after all. And then imagine it goes poorly and the teacher really does say something critical. In this case, I can tell myself, yeah, that was uncomfortable, but I was able to handle that even though I didn't like it. And finally, by asking my teacher the question, I'm learning I can live my life without creating all these barriers and rules for myself just to avoid anxiety. And in fact, I'll probably get better at these kinds of social interactions if I give myself a chance to practice them. Now let's talk more about how to use exposure to build your tolerance for uncertainty. So first, think of all the things that you do or that your child does to satisfy that desire to feel a sense of comfort and certainty. Are they seeking reassurance by asking questions like, am I going to be safe, or how am I doing on this project? Or are they asking the same kinds of questions over and over again? Are they spending a lot of time checking their work or their actions, or spending time engaging in a lot of research to get the same kinds of information? Are they procrastinating or avoiding situations that make them more aware of the fact that uncertainty exists? It's really important here that you pay attention to the individual and tailor the approach to the ways that they express their anxiety. So remember, some people might be watching news or researching online too much because they're waiting to find some information that will make them feel sure of a positive outcome. On the other hand, the exact opposite could also be a sign of anxiety, and a person would avoid watching the news altogether because they don't want to face the feeling of uncertainty. So once you've identified these specific behaviors, you make a list of the exact opposite behavior. which is what we would call an exposure or an anxiety challenge. Rate how much anxiety each would cause on a scale of 0 to 10. Really here you could use any kind of scale, like 0 to 100 for older adolescents or adults who want to get really detailed in how they're describing their feelings and the intensity of their feelings. For even younger kids, you might just ask them to rate things red, yellow, green, like a stoplight. So tailor that to the developmental level of your kid. And then you start following through on the challenges, usually beginning with something that's easy enough you're willing to do it, but difficult enough that it will produce some anxiety or discomfort. Here's a specific example of a way to use exposure to reduce reassurance seeking or reassurance giving. It's important to note that you should work on this with your child or teen, because they're much more likely to try the strategy if you take a collaborative approach with them. So you don't want to surprise them by doing an exposure they weren't ready for or anticipating. So you would develop a list of what I call anxiety challenges that you and your child could work on together. For example, one of the easier ideas is to limit the amount of reassurance to just one time per day. Meaning if your child or teen is asking you a question that's clearly geared toward satisfying a need for certainty, make an agreement that you'll answer that question once and only once. And if they ask it again later, you simply remind them, I already answered that for you today. See if you can remember what I said, or wait until tomorrow and we can talk about it again. Next on the list, you might make a plan with your child or teen that you'll answer a question, but only after a set amount of time, like 5 minutes or 10 minutes. Next, you could simply label the worry for them and remind them that it's not helpful to talk back to their worries. For example, you might say, it sounds like you're having a worry that you might get sick. I know it might feel better if I tell you that you'll be safe, but we now know that answering your question doesn't really help in the long run, and it only makes you feel more worried. And leave it at that. And finally, a harder challenge might be to really point out that uncertainty exists, and this really is an uncertain situation. You would say something like, maybe it will happen, and maybe not. We can't know for sure. Again, remember, you need to discuss this approach with your family member before you try it, and always use your empathy and compassion even when you're helping them challenge their anxiety. Also keep in mind, everyone is going to rate these challenges differently. So it might feel like a 5 out of 10 for one person could be a 9 out of 10 for someone else. And so it's hard to predict or make assumptions about how someone will feel. And if I were to administer this kind of list of challenges to a random sample of teens, they might even put things in a different order of difficulty. So I can't even assume that they would be easier to harder in this particular order that I came up with. After the exposure or anxiety challenge, here are some questions to reflect on that will help build the sense of mastery and confidence it will take to repeat the challenge in the future. Ask yourself or help your child consider these questions. Was I as anxious as expected? Often you'll find the actual anxiety experienced during the exposure was less than expected, though not always. And it's okay if that's not the case. Next question, was the outcome as bad as I expected? Again, it's okay if it was. You can still learn a lot from these experiences. How well did I handle it? It's so important to recognize what a good job you did just by approaching the anxiety, regardless of the actual outcome. And last, if I could conquer this anxiety, how would that make my life better? Improving your quality of life is the whole reason that challenging anxiety and learning to tolerate uncertainty is important. And then challenge yourself to repeat the experience, or if you're ready, move on to a more difficult challenge or exposure. So when you embark on this process, you should expect that challenging anxiety will initially cause a rise in feelings of discomfort or distress. But these feelings usually improve the more you get accustomed to this new way of managing anxiety. And when you're a parent helping a child or a teen with anxiety, you probably will also experience some distress just watching your teen feel uncomfortable. Try to follow the same advice you're giving your child, tolerate the distress. And when you do that and resist the urge to provide unnecessary or unrealistic reassurance, You're showing your teen that both of you are strong enough to handle feelings of anxiety. So to summarize, here are our final reminders. Consider your values, what really matters in life, and how is anxiety keeping you from pursuing the things that matter? The first skill in challenging your anxiety is learning to recognize our worries. Label them. So instead of feeding right into your worry or thinking right about your worry, think to yourself first, I'm having a worry that. To quote Mr. Rogers, anything that is mentionable can be more manageable. And then identify when your anxiety is really about a sense of uncertainty. Practice accepting reality, including the fact that some things are unknowable. And recognize and change the behaviors that are attempts to gain a sense of certainty in uncertain situations. We'd like to acknowledge and share some of the resources we use and regularly recommend to parents: Anxiety Canada, the International OCD Foundation, and Anxiety in the Classroom, which is a new resource created by the International OCD Foundation for teachers and parents. Thanks so much for your attention, and now we'll take some time to answer questions if there are any.
Thank you, Dr. Toledano and Ashley. That was a wonderful presentation. I do have a few questions that have been asked. One of them is, how do I get my child's teachers to support the same approach to anxiety that we use at home?
I think that's a great question. Ashley and I have both worked in schools. I think we've found that teachers tend to be really great partners in working with anxiety. Every teacher I've worked with is aware, all the way down from kindergarten, that anxiety is present in our classrooms these days. I think there are a spectrum or a continuum of informal to formal types of approaches you can take. And so on the informal side, I would just start with a conversation. Maybe describe your child's symptoms and what they're going through, and talk about what you're doing at home. There are certainly lots of formal approaches, and I don't know if that's beyond the scope of the question, but things like Section 504 plans or individualized education plans, or taking a little bit of a step back. Often there are formal systems for providing interventions in different types of schools. And that's a great place to intervene. I think we often think of academic problems first when we talk about developing plans and creating actual agreements with schools to help our kids, but anxiety is just as real a problem, and it's something that you can certainly build some plans around.
I agree. Before I worked here, I was a school and community-based therapist, and that was a great position to be a bridge between parents and schools to help implement some of those kind of things and help get the classroom and the home environment on the same page with, treating whatever it was, anxiety or ADHD, or using those consistent behavioral approaches, I think is really important. And definitely a community therapist, or even a therapist that's willing to talk with your school counselor or something like that, can be a great bridge for those types of things.
Great, thank you both for those answers. Next question is from a person who says, my child has a tendency to go over and over and over the same thoughts and worrying thoughts. I guess I would call it ruminating, especially at bedtime. What are some approaches that can be used to help them settle in for the night and to stop those worrying thoughts that are running through their heads?
Yeah, I think that's exactly along the lines of what we talked about today. It's so helpful to recognize what those worries are. What we talked about really applies to a range of ages. There's no child who's really too young for an exposure type approach. And I think any kid can kind of understand or buy into the idea eventually that feeding those worries and fueling those worries by continuing to think about them or trying to get answers for them is only making it harder, and making that problem worse. And so, you know, one thing that wasn't in the question is how do you respond as a parent? And I certainly know even if you're not responding, a kid can certainly independently continue to ruminate. And you just kind of tell them the same thing about, just like you as a parent wouldn't provide them reassurance to fuel those worries, they don't need to provide reassurance to themselves in their own minds by telling themselves those thoughts repeatedly of, well, it's going to be okay, or maybe checking out the whole situation and trying to reason their way out of it or logic their way out of it. One of the things Ashley presented was about how worry feeds on that tiny, tiny bit of doubt. And so there are so many situations that no matter how much you think about them in your mind, it feels like I can 99% of the way get there through logic to tell myself the bad thing isn't going to happen, but that 1% is going to keep bugging you, and that's enough to keep the worry going. So at some point you just have to shut down that logical part of your mind and say, this is a worry and I'm not going to keep talking to it.
Exactly. And Shanee, as you're talking about that, I'm thinking of that book that I really like, Wilma, The Worry Machine. If it's a younger kid, and we can share the link to that book as well. But in that book, Wilma has a lot of worries, and her teacher helps her make a list of all the things she can control and the things that she can't control, and put them in a worry hat. And she, can put on that the worries are always there in the hat, but she can also take off the hat. So I'm thinking about something like that at a ritual around bedtime that could be helpful, like, if you've established something like that, and like, we're going to take off our worry hat now because it's time to go to bed. And sometimes those small rituals, especially for littler kids, can be really meaningful and can be really helpful.
And for older kids, one of the websites that we mentioned right at the end, Anxiety Canada, has kind of a self-help section for youth that really goes through all of those educational materials and talking through that kind of problem.
Great, thank you. Next question. How do I manage my anxiety around my child's anxiety?
Yeah, that's a big one, right? I was just talking to a family about that today, and it's definitely something that Shanee and I talk about a lot, that a lot of, managing reassurance seeking and managing anxiety from parents, it's very uncomfortable and distressful for most parents to see their kids feeling so anxious, and especially if you're going through something like exposure and seeing your kid kind of be in an anxious situation and trying to refrain from reassuring them, absolutely can validate that is a very distressing experience for parents.
I want to point out that I think it's easy for parents sometimes to see the importance of not giving into a tantrum. So your kid is wanting a candy bar when you're leaving the grocery store, throws a fit, is on the floor, making a lot of noise and crying and yelling. And we all know in that situation, don't give them the candy bar. Next time you go to the grocery store, you're going to get that times 10. I think it's so much harder with anxiety sometimes because the behaviors look different, and we certainly don't want to punish a kid who's feeling anxious or make someone who's feeling anxious feel even worse. But we have to recognize that it's almost like when they're having these worries, that there's a worry monster behind it that's generating these worries and that's managing your kid's behavior for them. And if we engage with that worry monster, it's like giving into a tantrum. And so you really have to hold a firm boundary with that and not feed into that worry, even though it's hard and even though they'll feel more anxious in the moment. You really have to know and believe that you're doing the thing that'll make it better in the long run.
Thank you. Another question. are medications ever recommended for the treatment of anxiety? And if so, when?
Yeah, you know, there's lots of good research on the use of therapy or behavioral approaches and medication or, you know, pharmaceutical approaches. With anxiety in kids, a lot of the research suggests that both are effective independently, and sometimes the most effective outcome is when you're using a combination of the two together, therapy and medication treatment. And that's such a personal decision, and people have such strong feelings about it one way or the other. I think it's just something to really talk with a medical doctor about, like a psychiatrist, or start with a pediatrician if you don't have a psychiatrist, and just find out more, learn more. You know, prescribers typically are also really willing to talk through all the pros and cons and possible side effects of medication with you without you having to commit to a medication. So that's, if you're having that question, I'd say just start there. It doesn't hurt to ask.
Okay, that's all the questions we have, and that's great because we're coming right up on the 8 o'clock hour, or 7, depending on where you are in the country. I want to again thank our presenters, Shanee and Ashley, and I also want to say that we will be sending out an email tomorrow that will have a link to an evaluation so that you can give us some feedback on this program tonight. And also we'll have a link to the recording of this presentation. So if there's something you missed, if you ended up coming in late, or you missed something because your child needed you and you want to review that, we will have that available for you. And so with that, Julie Dukowski has a couple of closing comments, and then we'll end for the night.
Hi everyone, I'm Julie Dukowski. I'm one of the 5 National Referral Relations Coordinators here at Skyland Trail. I cover primarily Georgia, Tennessee, and Alabama. And I just wanted to take a couple of minutes to thank all of you for joining us this evening. We're so glad that we were able to reach so many of you from so many different areas, Texas, Georgia, and several other states across the nation. I hope that this evening you were able to glean knowledge and tips that will be helpful to you as parents, as you support your child's social, emotional, and mental development, especially during these very uncertain times. We at Skyland Trail look forward to continuing to collaborate with Fusion Academy and Archway Academy to support individuals and families, particularly during these very challenging times. I do hope you'll be able to join us for some of our future Family Education Series events. The next one is coming up on Tuesday evening, July 7th. That's dealing with issues of control and compromise in parenting teens. And the following one will be Parenting for the Launch on Tuesday evening, August 4th. Please feel free to reach out to any of us if we can be of assistance in any way. I hope you are all well and your loved ones are safe and well and will continue to be during these times. And we hope to see you again very soon. Have a great evening. Thank you.